Alright folks, welcome to it, man. This is What's Your Role, and we are joined right now by Dr. Dolly. She is a dermatologist and she's going to tell us a little bit about her role and some of the job functions that she operates on. How are you doing?
I'm great.
Thanks for having us.
Thank you for being here.
Alright, so tell us a bit about the process. How do you become a dermatologist? Why did you get involved? And generally, what is the role of a dermatologist?
Oh, that's a very loaded question. But I would start by saying that we're medical doctors and you have to start by obviously going to medical school. Following medical school, you then subspecialize into dermatology. And it pretty much depends on which path you take. The path that I took, I did my specialization in New York, which is where I actually spend part of my time. And I go back and forth between New York and Trinidad. The role of dermatology has changed over the years. Originally, it was the name of dermatologist was actually venerologist. So venerologists are actually people who just specialize in sexually transmitted diseases. But I think we're looking at 1.5 centuries ago. But by now, we take care of the entire skin. We're actually considered the custodians of skin cancer. So we're very much needed in the surveying and treatment and obviously the diagnosis of skin cancer. But we also treat a lot of the everyday rashes or eruptions that you want to call it on the skin. Particularly, everybody will know about acne, or some people call it pimples, psoriasis, eczema. Those are, I would say, the top 3 very, very common skin conditions that you would just find. And I would add on, in Trinidad, I would add on other things, something called melasma, which is pigmented or dark patches on the face that it's very, very, very common in people of color and people who are in areas of lots of sun exposure.
Now, earlier on we were speaking and you told us about the skin care scan that you do. You do like a little something to test the age of your skin. I think we're going to try that out a little later on as well.
Yeah, try it out a little bit later. So basically, I utilize a tool that's called Vizia Skin Analysis. It's a tool that I find very useful to give patients a realistic idea as to where their skin is at. Sometimes they come into the office, yes, they may think that they have problem A or problem B, but then I may be seeing problem C, D, E, and F. And I think the Vizia Skin Analysis is what we call an objective measures to where your skin is at. It also would give an estimate of what we call your true skin age. And many people are very, very interested in what your true skin age actually is.
So what difference does it make when you figure out what your true skin age is as opposed to your actual age?
Well, your true skin age is calculated based on the amount of wrinkles that you have, the amount of brown spots that you have, the amount of UV spots or sunspots that exist, as well as a couple of other indices is what's used. So I would anticipate that somebody you wouldn't really want to look older than what you are. Some people maybe want that chiseled, old, mature look, but I would say most people coming into the office, they would want to know where they're at in terms of how old are they looking, because some people would want to at least reverse the hands of time a little bit.
So I did not mention reversing the hands of time. So you figure out how old your skin is and maybe older than you are. What do you do then?
Depending on how old it is, the question would be, what do you want to do? Are you comfortable with being 1, 2, 3, 4, 5 years older than your age? And if the answer to that is no, then I would introduce you to a treatment regimen that may help. If your main problem is pigmentation, we would address that. Very common to get a lot of acne, so we treat a lot of acne. And you, believe it or not, just having acne can increase the age of your skin, because just think about your skin being irritated and inflamed all the time. It does get tired and weathered and aged. So even the acne patients would want a fresher, new look to their skin.
Thank you very much. Well, let's go and do this.
Sure.
You don't want to take off my skin though?
No. No needles involved. No blades.
Okay.
Okay?
Are we going?
Good. So you're gonna follow me?
Mm-hmm.
So your actual age is 32 and your true skin age is 25. So I have to give you a high five for that. I think you've done the best out of anybody. About 7 years younger. Most of my patients come in and they're way above. You're way under.
Yeah. Oh God.